Experimentally, if you have people stop brushing their teeth, plaque starts to build up, and within a few days the gums start to get inflamed. You can't see anything yet, but if you take a biopsy at the gum line, you can see the inflammation starting to spread. And within a few weeks, overt gingivitis becomes apparent, where your gums can get red, swollen, and bleed easily. And if you don't do anything about it, you can develop periodontal disease, where the inflammation creeps down into the supporting structures of the tooth, the bone and ligaments, setting you up for tooth loss. OK, but how did we get along for millions of years without brushing? Yeah, dental disease is almost universal these days, but thousands of years before the invention of the toothbrush, there are skulls with perfect teeth. What about the role of nutrition in periodontal health? Maybe it would help if we sought out foods that are antioxidant-rich. So is there an association between dietary vitamin C intake, for example, with periodontitis? Apparently so, with increasing risk of periodontitis associated with lower levels of vitamin C intake, but you don't know until you put it to the test to figure out what effect vitamin C depletion and supplementation would have on periodontal health. They basically locked everyone up for 3 months so they can provide controlled amounts of vitamin C, and measures of gum inflammation were directly related to their vitamin C status. On about 1 orange worth of vitamin C, their gums improved, but then down to 5 milligrams a day, they got worse. But then on 10 oranges worth a day, they got better, and then worse again, went back down to 5. But that doesn't mean taking extra helps. And indeed, 1,500 milligrams of vitamin C a day did not seem to help prevent gingivitis, and even 2,000 a day failed to help periodontitis sufferers. Maybe vitamin C is just too weak of an antioxidant? OK, what about lycopene, the powerful antioxidant pigment that makes tomatoes red? It worked, but that was from injecting the stuff directly into the gum pocket with a syringe. Does it work if you just eat it? Let's find out. A randomized, placebo-controlled clinical trial on the efficacy of lycopene in the treatment of gingivitis. 2 weeks of less than a single tomato a day's worth of lycopene versus placebo for 2 weeks, both along with a standard dental treatment, which helped a 10 to 20% reduction in gingivitis in the placebo group, but nearly 30% improvement within just 1 week in the lycopene group. And this was just like the amount of lycopene found in a teaspoon and a half of tomato paste a day. Totally doable. OK, so tomatoes may help with gingivitis. What about periodontitis? Another randomized, double-blind, placebo-controlled trial, again, treated with usual dental cleaning plus either that 1 tomato a day's worth of lycopene or placebo for 2 months. And significant improvements in plaque, gingivitis, and bleeding, though not probe pocket depth and clinical attachment. You can see the difference. See how much better their gums look? They conclude that supplementation with lycopene seems to have augmented the healing sequence of inflamed gingival tissues. OK, but that was with a whole tomato's worth a day. How about half a tomato's worth, or just 3/4 of a teaspoon of tomato paste worth of lycopene a day? It didn't work. No difference. So it looks like you have to go the whole tomato.